Well, hello there. It's Dr. Brian McKay, Core Health Darien, and today we're going to talk about back pain post knee replacement. Now, you're probably wondering where I come up with these crazy titles or interesting articles. So, basically, what I do is I write an article and I do a podcast on it. My podcast being Not Just a Chiropractor for Stanford, Darien, Novo, New Canaan. A little lengthy, but gets the message across on what we do. So starting to see a number of people, you get to be a certain age. This actually happened, it used to be people really, really old to get knee replacements, but you're seeing it start a lot younger, a lot younger. So what you have to consider is you replace, you're taking the body part out. And I'm not, if you need a knee replacement, you need a knee replacement. There's no argument with that. I mean, you'll basically, the orthopedics will tell you, you'll know when you need it. And it does change your life. But what happens afterwards is the body's got to acclimate to the new hardware that you're putting into your system. Um, so you can look forward to a few things. One, probably is going to be some back pain, and I've seen it. That's why I'm talking about it today. And what happens is, the knee is one thing, but now all of a sudden you're dealing with how does the body adjust to the new height. So it's one of those things. I mean, you may need orthotics for your shoes, for added support, but basically your leg length is going to change. It's an exacting science on how much they're putting in. It's a pretty standard piece of metal, and it depends how much they got to take off when they go and remove the bad parts of the bone. The bone and bone is worn away, so you can definitely look and expect to have a leg length imbalance. And what a chiropractor does is put that back into better spots. Okay, so it's like there's going to be a stress placed on your low back. There's no doubt about it. I mean, again, like I'm seeing a lot of it lately, and people are tending to be in their 50s getting knee replacements, and they usually the talk is you're going to get 20 years. Maybe now you're getting 25 years. So understand if you do it that early, you probably will have to have it done. A little tune-up job a little later on in life when you least need it. So what happened is it's kind of not a bad idea to go see, and of course it's very self-serving for me to say go to a chiropractor, but before you get the knee replaced, go and make sure everything's working as best it can. And I'm not talking about a long course of care. You go in for a few adjustments, it'll make a really big difference in how you heal afterwards. So it's kind of it's a kind of, to me, it's a no-brainer. More obviously it's physical therapy involved, which you've got to do after a knee replacement. You'd be crazy not to. But to come in for a little bit of a tune-up prior to having your knee replaced, and then after not right away, because you ain't gonna be bending that thing for a while, but in, like, a couple of weeks post surgery, go in and get the body balanced out. Here's what you got to think: if you alter the structure, you're going to alter the way it functions. If you all take out part of a knee and replace it with a metal implant, it's going to change the way the structure works. So it's going to probably jam up in your pelvis more than likely. So if you come in, get your pelvis adjusted, and the adjustments we call is the chiropractic treatment, or you remove the subluxation, that is where and how we can help someone with knee pain and back pain. Okay, I'm not going to fix your knee. If you need to get replaced, that's out of my league. However, there are things we can do to make sure that you have a good encounter when maximize what you want to do with with the knee, by giving yourself a good fighting chance to get everything fixed. Listen, I'm Dr. Brian McKay. I urge you, if you're getting your knee replaced, go get a few adjustments. I'm not talking a lot, just a few. And we'll talk to you soon. Thanks very much for listening. Have a great day.